Let's talk about 3 different upper body kind of shoulder injuries for baseball pitchers that you're gonna see. 2 of them are pretty common, unfortunately. One of them, also unfortunately, is something that you don't hear a lot about historically, but you're hearing more and more about, and it can be really kind of a pain in the shoulder. So the first one is that you're probably familiar with, rotator cuff injuries. So that can come in the form of a tear, a complete tear, so a partial tear or a complete tear of the rotator cuff, or it might just be something else. But what they tend to refer to is the rotator cuff, which is actually 4 different muscles. So you got kind of one in the front and the back and 2 over top. So it's actually a set of 4 different muscles making up the rotator cuff, which kind of encapsulates, it just covers the shoulder. And well, so if you take this bicep bone here and it gets held in there by a bunch of different things, 4 of which are the rotator cuff muscles. When one of those gets aggravated, irritated, partially torn, or completely torn, you have a rotator cuff injury. So it's kind of a way of, or an umbrella way of talking about a bunch of different things in there. It's just less specific. So what happens with that is either an overuse or an anatomical issue or a freak accident. Those are kind of the big 3. The freak accident is not going to tend to be shown up in baseball players. Now you can get it. I know there's people that go snowboarding and they've jacked up their rotator cuff muscle. There are people that maybe if they do try to throw really hard and they haven't thrown really hard or at all in many, many months and tried to just let it loose, potentially they could be injuring themselves with a rotator cuff injury. But it tends to be a matter of overuse for baseball pitchers. But let's not simplify it too much. It's a little bit more complex. It could be overuse with lack of strength. It could be overuse with bad mechanics. It could be overuse from overuse. So if it's a lack of strength, it's because that player either never had the strength or maybe had a little, but just never really trained it. So there's different shoulder exercises you can do. Even just push-ups are really good for basic, but there's tubing. There's all kinds of things you can do to strengthen the shoulder joint. Because what happens is you use your body as much as you possibly can, and then at the very last second, your arm is coming through, it's coming out like this. There's a bunch of different things, including the rotator cuff muscles, that are trying to stop this arm from basically falling off. Your skin's helping too. And those things have to work really hard, and we need to get those strong. So if they're not very strong, that can be an issue. Mechanically, if you're not using your body very well, and you really have to put a ton of force in rotation with your upper body to try and make up for the lack of using the rest of your body, then there's added force, and that can be a ton of stress that isn't necessarily needed on your upper body. You shouldn't have to work as hard with your upper body if the rest of the body is happening. And the last thing, overuse is when a pitcher just throws way too much. A coach, as the adult, is not stepping in and saying, hey, you've never thrown this much, and that was 40 pitches ago. You need to stop, and you need to take some time off. Not a day, not a week, but you might need to take 2 weeks off. You might need to just shut it down for the rest of the season. So if an adult is not stepping in, overuse can be an issue. But there's a lot of different factors. Most people just say, oh, overuse, the end, he threw too much. It's not always that simple. So that's typically your rotator cuff muscle or muscles, the whole area, the injury reasons. Little league shoulder is going to have a lot of the same reasons, but the little league shoulder is going to tend to be a chip in the bone in this area or a chip in the growth plate, similar in nature. You know, you'll see it in x-rays where the bones just aren't at, like, let's say this is the top of the bone. So this is a bone right here and this is the top. This just doesn't look as white, we'll say, in the x-ray. It's just a little more blurry. It's not completely grown in, or there's areas where it looks like it's going to grow more and there's a little bit of a tear in, not tear, you don't tear your bone, but there's a little bit of a crack in there or a chip. They just basically classify that as a fracture or a break or a growth plate fracture break. You're going to hear it termed a bunch of different things, whether it's a doctor, you're reading an article, or you're hearing it from someone. But little league shoulder tends to be a classification of some type of bony issue. It could, depending on where you hear from, could be a muscular issue as well. They might just throw the blanket of little league shoulder, saying that, hey, you're of little league age, you're still a youth athlete, and you've got a shoulder issue right now. And then what the doctors are going to do, kind of for both, is hopefully, first of all, they're going to say, hey, let's just hope it's not a big issue. Let's take an x-ray. Okay, x-ray is great. Let's just do some time off for a couple weeks, some rehab, and get them back. So the way the progression typically goes, time off, exercises, kind of in either order, check back up. So if both of those aren't working, the exercise is getting stronger, taking some time off, those still don't work, then they might get a little more invasive, meaning they're going to maybe get an MRI or refer you to physical therapy where it's 6 or 8 weeks of a lot of exercise. And then if all of those don't work and the MRI still doesn't come back clean, or if the MRI does come back positive for some type of other injury where they're looking at the muscles, then they might talk about surgery. They might talk about a long time off with a lot of physical therapy. So those are kind of your options. Obviously surgery would then have rehab and all that, but we don't want it to ever get to that point. Typically a little league shoulder doesn't get to the point of surgery if found early, if recognized early, and the player mentions it to their parents or the coach or someone, and they kind of start to take care of it. So rest and or exercise, definitely some exercise and rehab, and then taking care of what the next steps are, which is hopefully you're healthy, or you have to get an MRI where they can see the muscles, and you keep talking to the doctor, and that's the progression. That's why it's so important to take care of your shoulder health beforehand, so you never have to get to this point. So that is your rotator cuff muscles, or rotator cuff tear. That is your little league shoulder. And then also the last thing I just want you to know about that's not as common, like I referred to, is called thoracic outlet syndrome. I won't get into the details of exactly what it is and a whole bunch of medical terms in that, but I want you to be familiar with thoracic outlet syndrome because it can be a real pain in the neck, the shoulder, the arm, a bunch of different areas. What's basically happening is you've got veins, arteries, things that go all throughout your body. And because of either it's going to be typically because of your anatomy, just the way your bones are made up. Some people actually have an extra rib, and then some people have just where their rib and their collarbone are closer together. So what happens is all the stuff, all the veins and the arteries and things going through, go sometimes in between your ribs, and sometimes when it's going through, it gets pinched. So your ribs are either closer together. Again, some people have an extra rib in between the collarbone and the ribs. This area right in here gets squished. It squishes those veins, those arteries, those things like that make you sometimes feel tingliness in your pinky or your hand or your thumb, or your wrist starts to hurt, or your bicep, and this is where it gets really difficult. So this is why I want you to be aware of it, so you can always ask a doctor about it. If you're like, hey, I'm having a bicep issue, or an elbow issue, or my hand is tingly, or it's numb, or something in my forearm, or maybe I have a neck issue. Because with that going on, unfortunately, you can't say, oh, my wrist hurts, so it's my wrist, or my elbow hurts, so it's my elbow, or my shoulder hurts because it's my shoulder. It's a little bit more complex than that, again, unfortunately. But you knowing this is good because you can ask the doctor. Doctors didn't really diagnose this. They didn't know about this as much 5, 10, 15 years ago. More and more people are talking about it. There's more articles coming out, but there's still not as much information. But just to warn you, it can actually get pretty bad because of the things that are getting squished in there. So there are people that get discoloration in their hands. If you get any type of discoloration or tingling, definitely talk to a physician, your athletic trainer, so someone can start to look at it right away. And don't be afraid to ask, hey, could this be something like thoracic outlet syndrome? So ask the question for sure, because it can actually get pretty bad when you're messing with veins, arteries, and all that kind of stuff. So tingliness is something that you might recognize. Pain in a bunch of different areas. Typically pain can go away with rest, with exercise, with physical therapy. But when it persists and just doesn't go away for months and months and months, that's when you need to definitely be asking more questions like, okay, if we've got the MRI and that looks fine, we've got the x-rays and that looks fine, can we look at other areas? Because again, you can't say my elbow hurts, so let's just look at the elbow. There's a lot more factors. Strength deficiency is a huge one, so that's where they're gonna try and target first. But really it goes x-ray, MRI, where they can see the muscles and those tendons and all that stuff. And then they can also do an MRI with dye, where they add a color component. So it shows up even more on the MRI. So that's something. And then definitely be asking about thoracic outlet syndrome, so you can know if there's something going on up here in your neck area, your shoulder area, that is then causing a pain in here or somewhere else.